Hi, I'm Josh, and this is a short daily yoga therapy practice you can use for lower back pain. Of course, I recommend getting your back assessed by a professional to find out the cause of your lower back pain, but this should be suitable for most people. What we're going to do is start on your backs in this position, and it will probably feel more comfortable to have your knees bent. We're going to have the hands on the belly, and we're going to close down the eyes. Just use this moment to relax the body and start to tune into your breathing. You can breathe a little bit deeper and a little bit slower. Our breath can become shorter when we're in pain, so this chance is your moment to elongate and deepen the breath, encouraging the belly to rise as we breathe in and fall as we breathe out. Let's take 3 more breaths in this way. Taking a deep inhale, expanding the belly, and slowing down the exhale. We can start to synchronize the movement with our breath. So as you breathe in now, you're going to arch the spine and push your tailbone into the floor. As you breathe out, you're going to squeeze your tailbone under and lift your hips off the floor slightly. Inhaling, arching the spine. Little micro movements of the lower back and pelvis. Exhaling, the tailbone under. Let's do this another 3 times. When we're suffering from any form of pain, it can cause our movements to become not so well controlled. So by starting in this simple movement, it can just regain those little muscles and movements that we can lose in the lower back. We're using the inhale to arch the spine, creating a gap between the back and the floor, and an exhale to push the lower back into the floor. Nice. Let's now bring the feet a little bit wider. Take a breath in and a breath out just to bring the knees to the right. Inhaling the knees to the center and exhale the knees to the left. You can carry on this movement, inhaling the knees to the center, having the arms above the head and exhaling the knees over to the other side. Gently loosening the hips and experiencing the sensations in the lower back. Let's finish on the side you're coming to. And then we'll come back to the center and bring our hands onto our knees. Inhaling now to bring the knees away and exhaling the knees in towards the chest. This isn't meant to be an intense stretch, but we're just opening the lower back and finding the stretch at the end of the exhalation. As we breathe in, the knees move away. As we breathe out, bring the knees closer. Let's continue this movement for another 5 breaths. Exhaling the knees into the chest. Inhaling the knees away. We don't have to rush the movement, but stay in synchronization of your breathing. And then we're going to let go of the knees, hover the shins to the ground. This can be quite intense for our core, so we can bend the knees if it's challenging. Hover the knees here. Push the lower back into the floor. That's going to wake up your core. Maybe we'll even rise the arms up above the head, or have them overhead or by your side. We're going to hold it here for 5 breaths. You're going to push the shoulders into the floor. Push the whole spine into the floor. And try to breathe with some ease. 4, 3, 2, 1. Hug the right knee, extend the left leg out. Pull the right knee in towards the chest and pull the left toes back. Squeeze that knee inwards and take a full breath cycle here. We're going to swap it over now. So the left knee is going to come into the chest. The right leg's going to straighten out. You find the posture, then you find your breathing to relax the hip and the lower back. Bring the soles of the feet down onto the ground now, back into that original position. Now, bigger movements. We're going to lift up the whole back off the floor as we breathe in. Feeling the back strengthen, the glutes and the hamstrings engage, and exhaling the spine back down to the floor. We'll do this 3 more times in this way. Inhaling, exhaling, gently lowering down. Two, exhale, we can lower. 1, and lowering. If that was tricky, carry on as you were. If you want a little bit more, we can open the chest as we rise the hips, inhaling and exhaling. The hips come down and the arms come down. Let's do another 3 of these. Using the inhale to rise and the exhale to lower. 2. And 1. We can then roll onto our side and push ourselves up onto all fours. Starting to mobilize the entire spine now into our cat-cows. So our hands will come underneath our shoulders. Our knees will be below our hips. And we can inhale into this extension of the spine and exhale to round the spine. If you've had back pain for a while, this can feel quite abstract. So maybe we can close the eyes and encourage the back to round, the hips to tuck under, the mid-back to push up towards the sky. And inhaling, we do the opposite. Arching the spine, looking up. And exhaling to round. We're going to change this movement slightly. We're going to inhale as we were into our cow shape. And exhale round, push our hips back and just touch our forearms to the ground. As we breathe in next, we can arch our spine into the original position. And exhaling, rounding, pushing back and just touching the forearms to the ground. Let's do this 3 more times. We can walk our way forward now and come to bring ourselves down onto our tummy. We're going to come into a Sphinx position where our forearms are in line with our shoulders, elbows underneath our shoulders and hands in line with our elbows. We're going to push the ground away as we breathe in and exhale, lower ourselves down. Inhale, pushing up. Exhale, lowering down. And on this one, we're going to hold. Lifting up, squeezing the shoulder blades together, looking up towards the sky. We don't have to find pain in the lower back, but we can just hold the posture in a position that's comfortable. Maybe back off if we need to. And then we can lower ourselves down. Feel the back muscles engage and lift the chest off the floor. Lift the arms off the floor. We're going to hold this for 3, 2, 1. Bring the hands down and bring yourself back to a tabletop position. In your tabletop position, you're going to reach the right leg back and hover the right leg. Lots of people will hike their hips up, but try to keep the pelvis level. If you're feeling steady here and there's no discomfort, you can bring the left arm forward. We find some balance here, and we hold for 3. Slow breaths. 2. 1. Bring the hand down, bring the knee down. Left leg reaches back, right arm reaches forward, or your right arm is down. You're changing the posture for your ability. Holding for 3, 2, 1. Bring the hand down, come to high kneeling, and then we're going to bring the right foot forward. Bring it right far forward so that you can push your hips forward and down and your knee doesn't overtake your foot. We might be up here and feeling a lot of tension in the front of the left hip, and that's where we hold it. We're going to have our hands on our knees and we'll move the left arm with the breath. Inhaling the left arm up and exhaling the left arm down. Inhaling the left arm up and exhaling, bringing it down. On this breath, we're going to rise the arm up and then connect the hand to the floor. We can then twist and bring the right arm up. A full breath here. We can bring ourselves back up into a high kneeling position, and we'll just do the same on the other side. The left foot comes forward, we'll move the hips forward and down, taking a breath to settle here with our hand on the knee, and then we'll inhale the right arm up and exhale the hand down. Inhaling 2. Inhaling 1. And exhale, connecting the hand in line with the foot. Inhale the left arm up, taking a breath to settle here. And then we can bring the hand down, bring the back foot a little bit closer. We might even curl the back toes and try to come into this forward fold. We can bend the knees if there's a lot of tension in the lower back, and we can just try to relax the upper body down. Again, not forcing if we're in pain, but just breathing here. As you take your next breath in, you're going to lift the spine up to a half lift. This might be here for some people. We might be a little bit higher to keep a nice straight spine. Push the bum back and we'll hold here. If your back is strong, we can bring the hands onto the back of the head. Or we might want a bit of support from the knees. Next inhale, we're going to rise all the way up with a strong spine to stand. Balance is really important for a strong, healthy lower back. So we're going to do a little bit of balance practice by either bringing the toes together, or if your balance is not so great, the feet will be further apart. We can inhale onto the balls of the feet and exhale, bring the heels down. Let's bring the arms as well. Inhale the arms up onto the balls of the feet and exhale, lower down. 3. Inhale number 2. Inhale number 1. Last few strengthening postures to really bring this back into a good place. You're going to step back with the right foot. Not so much of a wide stance, and we're going to have both knees straight. If you struggle to balance, bring your feet wider apart from one another. And you're going to inhale, lower the back knee down, bend in both knees, and exhale, come to stand. 6. Inhale, number 5, lowering down, chest up tall. Inhale, 4. We might be able to touch the knee to the ground and coming back up. Inhale, 3. And standing up. Inhale, 2. Inhale, 1. You can come to swap the feet over. The left foot steps back. And then we're going to inhale, bend the knee, bend the front knee and the back knee, getting the knee as low as we can comfortably and coming back up. 6 repetitions. Inhale, 5. Inhale, 4. Inhale, 3. Lowering down, 2. And 1. Come to step back at the top of your mat. Feet shoulder distance. Lift up the toes as you breathe in. Connect the toes to the floor as you breathe out. Grow taller out of your lower back. Bring your shoulders back and down. And we'll close the eyes for for 3 slow breaths here to finish our practice. Awareness across the body, awareness of our breathing. And you can congratulate yourself for taking the time to mobilize, strengthen your lower back and look after yourself. Thank you for practicing me today. Hope you enjoyed this and hope you can continue this practice every day until your back is feeling a lot better.